Probably one of the biggest questions that we get asked is what actually happens during an autism assessment? What can they expect? For working within the Muir Practice, the first thing to expect is having a 30-minute free initial consultation, which we offer as an online meeting. Some families don't like the camera, and that's absolutely fine. So if it's online and you don't want the camera on, then you can just switch the camera off, and that's absolutely fine. Families are able to include their child as much as they feel is suitable. Often children who are able to communicate and have awareness of what they're going through, then it's really beneficial for them to be involved. But it's really down to the parents, and they know their child best, so we kind of follow their lead. So the initial consultation is with one of our neurodevelopmental practitioners. Within the Muir Practice, we work as a multidisciplinary team, so we have occupational therapy and speech and language therapists who are assessors for autism. So you would be meeting with one of them for half an hour, and it gives you the time to speak with one of our professionals, to ask any questions about the process itself, and for us to kind of gather some initial information to make sure that this assessment is the right fit for you. And it also helps you decide whether we are the right fit for you, for your family. So following the initial free consultation, and if you decide to go ahead and continue with the assessment process, we start straight away in pulling together information. So we're information gathering at this stage. So when we're information gathering, we are sending out a questionnaire to yourself, to the families, and then we're also sending out a questionnaire to school if that's appropriate, if your child's in school or nursery. Or if it's with an adult, then we would be seeking an additional support from someone that's close to you. Following information gathering, once we've gathered that information, we would arrange an online meeting with the parents to discuss the information that we've pulled together and ask any more relevant questions if we're needing more information. And then following that, when we're interviewing parents following information gathering, often parents can find this difficult. It can be an emotional experience, and that's absolutely okay. We're there to kind of support you through this. Often when parents are talking about their child's and their child's needs, they become more aware of their needs as well, and it's often that parents then start to associate themselves as being potentially autistic as well. After we've had the parent interview, the next step is the direct assessment, which happens in the clinic in Giffnock. One thing that makes our process different is that every assessment has a multidisciplinary approach. So what I mean by that is that we have a speech and language therapist and an occupational therapist who are both neurodevelopmental practitioners who have been trained within the NHS and often currently work still in the NHS. And they are both looking and supporting your child to understand their differences and their strengths within the assessment process. Our autism assessments follow NICE guidelines and are gold standard assessments. When the team are assessing the child, the assessments that we use, or the tools we use, we may use tools such as the ADOS assessments alongside our clinical assessments and multidisciplinary discussions. So when we're doing these assessments, it's really important for parents and families to understand that it's not a checklist. We're looking at the child as a whole. So we're wanting to understand their social communication, their interactions. We're wanting to understand if they have repetitive behaviours, if their sensory needs, looking at their sensory differences. Our goal isn't to create pressure, it's to create an environment where individuals feel that they can be exactly who they are. Following the direct assessment in the clinic. So where possible, we provide feedback on the day of the assessment. We discuss the findings. We most importantly talk about the recommendations and a future plan for what's to happen next. So our reports don't just provide an outcome of the assessment. The report is aimed to help you understand the child in every area that has been assessed. It gives you the language to know how to describe your child, to your family, to your friends, to school, education. Families are often concerned that schools are not going to accept the diagnosis. The assessments are completed following NICE guidelines. If there's any question over the diagnosis itself from the Muir Practice, then it's our job to speak to the teaching staff and let them understand the detail and the content. We've not had any school refuse the diagnosis. Private assessment's different. Families report that they value the shortened waiting times, the flexibility and the time that's offered to complete each assessment. Assessments should never feel rushed. Understanding someone properly takes time. If you're wondering whether an autism assessment is the right next step for your child or for someone that you care for, then asking the questions is the best next step for you. Feel free to get in touch and book yourself in to the initial free consultation.